7-month thing. So we have got these lone B cell disorders. The first one is X-linked Bruton A-gamma globulinemia. That means there is absence of gamma globulins or antibodies because these are being produced by the B cell. So there will be any deficiency or defect in the B cell. Because this is X-linked, that means it is related to the sex in chromosomes that are X and Y. So it is X-linked, and this is called Bruton, maybe because it would be a scientist name or anything. Just you have to keep in mind this is X-linked Bruton A-gamma globulinemia. This is occurring because there is a gene in a BTK. There is a defect in a gene BTK that is responsible to form an enzyme that is tyrosine kinase. So because this gene is not working properly, so that no B cell maturation will occur. Tyrosine kinase is responsible for normal B cell maturation, and because since this is X-linked, that's why it will occur more in case of boys. Because for suppose we have got a mother that is defective with autosomal recessive problem. This is XX. This is homozygous XX problem. For suppose this was a sickle cell disease. Sickle cell is X-linked disease, and father is normal. So what will happen? There will be combination small x capital X, small x capital Y, small x capital X, small x capital Y. All the girls will get an abnormal. All the both girls. One girl is this. One is this girl. Okay, and another one is this girl. These both girls will get their abnormal gene from the mother, but their father is blessing them with one normal gene or with one normal allele of the X gene. Okay, that's why there will be production of some enzymes that they will lead their life successfully, and there will be no symptoms, so that there will be no problem to the girls. That's why we always say daughters are dearest to their father. Okay, daughters are dearest to the father because father is blessing them with the normal X gene. What will happen with the boys? That these boys will get their Y gene from the father. Okay, these both boys, but they are going to gain only one X gene or only one X allele of a gene from their mother, and both these genes are defective. That's why boys have no chance to be safe. Okay, that's why whenever you will get a question, you will always see a boy in that question. That's why I already told you in the first session that gender is very important in case of these scenarios. Okay, for suppose if you are seeing a girl with a problem, so you have to rule out the X-linked problems first, because there is less chance of X-linked problem. There could be. This is not like that there is absolute absence of the X-linked problems with the girls. There could be, because this mother is also X-linked. Okay, this mother is also has got the X-linked disorder. This mother is defective. So it is not like that girls cannot get the disease. Girls can get the disease, but they can get the disease when both the parents are defective. This means that this mother. Okay, I have to tell you one thing more from the genetics. This mother was a baby of two persons. Okay, was a baby of two persons, and from those two persons, for suppose mother was XX normal, father was XY. So maybe she got a combination of these two genes. Okay, that's why she is defective, or her mother was also defective. Small x. Now to this couple, all babies will be produced abnormal. So we can make a combination. Can you help me in making combination? Tell me. Small x, defective. Okay, so small x capital Y defective. Again small x defective, small x capital Y defective. All the babies are. So in this case you have got 100% chance of the X-linked disease. All the babies in this family will get sickle cell disease from their mother and father, because both their mother and father are also defective. That's why only one of them will get it. Sorry, what are you saying? Yeah, because mother is defective, mother is small x, father has got one x, and that x is also defective. Yeah, No, we have not combination did the combination wrong. X small, okay, again X small Y capital, again X small, okay, yeah, we have did this wrong. Sorry, I am so sorry. Yes, you are right. So all these babies are defective right now. Okay, yeah, this could be the scenario, or this could have been the scenario. Okay, let me tell you one thing more. These babies belong to this couple. Okay, let me tell you one thing. There was a family which did incest. Okay, after 2 to 3 generations, they were so abnormal, they were diseased, they got so many diseases, so many genetic diseases, that they were like almost the animals. Okay, and that's why, for suppose this is a family. Okay, this is a family. Okay, for suppose these both are cousins to each other. So what will happen when they will marry each other, that this XY defective, when this marries to this girl, all the babies will be abnormal to this couple. That's why science says that you have to marry outside your family. Okay, and or incest is, that's why a sin. You can suggest. I am not going to deep in that topic, but just I want to tell you that that's why science tells you that's why science is describing that that you should not marry in your family. Okay, just because the genetic diseases will arise more and more. So moving on ahead. So now, since the B cells are not normal or not matured, we will get recurrent bacterial infections and enteroviral infections. That means the gastrointestinal tract infections after 6 months. Because till 6 months, the newborn baby has got maternal IgG via the placenta. So whenever you are going to attempt a question, there will be a 6 months old baby boy, or sorry, 7 months old baby boy. Okay, or 8 months old baby boy, 10 months old baby boy. But especially because these babies with X-linked Bruton A gamma globulinemia, these babies appear their symptoms on the 7th month most commonly. Okay, that's why whenever you are seeing 7 months old baby boy and he is having recurrent bacterial and enteroviral infections, you must have in your mind that it could be X-linked Bruton A gamma globulinemia. That is a B cell disorder due to defective BTK gene, due to defective tyrosine kinase enzyme, due to defective B cell maturation. Especially occurs in the boys, because fathers always bless their girls more. Fathers adore their girls more. Okay, now coming to the findings, because there are absent B cells, so on the peripheral film there will be absent B cells in the peripheral blood. Okay, whenever you will see it on microscope, you will put blood on your slide and you will get blood from your peripheral arms, peripheral veins, peripheral arteries. Then you will put it on a slide. You will not be able to see the B cells on that picture. And on flow cytometry or on different laboratory tests, you will find that there is decreased immunoglobulin of all classes. There will be, because since there are no B cells, so there will be no follicles. There will be no normal follicles. Okay, because these B cells get mature in follicles of the lymph node. We have already discussed that. There will be absent or in scanty lymph nodes and tonsils. Tonsils are also secondary lymphoid organ. Okay, so because the primary follicles and germinal centers, that means the secondary active follicles, are absent. Okay, since these are absent, because I already told you one thing, that whenever these B cells do, they produce antibodies. Okay, they produce antibodies. So what we do normally, we vaccinate our child. We put a glycoprotein of pathogen so that it could mimic pathogen inside the body and it could mimic the excitation of B cell. When it will enter the B cell will think that my body has got the pathogens, but rather the body has got this just only glycoprotein, so body will not be able to excrete, body will not be, so B cell will, since B cell is not normal now, so there will be no any kind of antibodies produced. That's why vaccination is not useful in this case. Okay, this vaccination is called as killed attenuated vaccination. Okay, because I have killed this pathogen and I have got this glycoprotein particle of this pathogen just only, so that it could mimic inside the body. First of all, this is the body. Okay, am I clear to you? Let me tell you this thing. Okay, because I told you this all first just because in these cases live vaccination are contraindicated. Okay, and that is because I just told you that normally we have discussed earlier, that we will kill the pathogen and we will get some component of pathogen and will put it in a syringe, so that we could inject it into the body. And in this body, when B cells will sense this or recognize this, B cells will produce antibodies, and that antibodies will be pre-made inside your blood, will be pre-made inside body in your blood, so that whenever the actual pathogen enters your body, these antibodies will kill them rapidly. This pathogen will not be able to cause you disease, or to cause you symptoms. Okay, this pathogen will be killed so easily, just because we already put a glycoprotein particle inside your body, so that B cells could sensitize them and produce antibody. Now there is another method of vaccination, and that vaccination is what we do to the pathogens. We do not kill these pathogens, we just make them attenuated, we just make them passive. Okay, by heating these pathogens. Okay, first of all, these were the pathogens, so what we did, that we heated them. Okay, we put them on fire. For suppose, can you give me a minute, there is a call coming, I should attend it. Okay, जी दादा मैं हॉस्टल दे हैं हिकिड़ो मिनट सिर्फ़ु रूम ते आहियां, फ्लैट दे जी Okay, are you there? Hello? Yeah, okay. So we were discussing that we will heat these. So we already just discussed that there is one method is that we will put glycoprotein of pathogen, of a killed pathogen inside the body. Another method is we will heat these pathogens, so that these active pathogens get converted into the inactive form. Okay, for suppose this line is showing inactivity and these pathogens are active, so we will put them inside the body. We will put them inside the body. Let me carry this inside the body. We will put them in a syringe and we will inject these organisms into the body. So now these are inactive inside your body, but these are still live. These are still alive. So what will happen? B cell. Let me remove this. B cell will sensitize these pathogens. Okay, they will enter the B cell and B cell will sensitize them. I am just keeping this cut because there is a process behind this, that first these are sensed by the macrophages, then macrophages take it towards the T cell, then T cell take it towards the B cell. Okay, so this is again a whole process. We will discuss that later, but for simplicity, just you have to keep this thing in mind, that this pathogen will be ultimately sensed or recognized by the B cell, and still this is inactive or not. This is live but inactive, or passive, but antibodies are being formed. Okay, because B cell has recognized this pathogen. Am I clear to you at this point? Okay. Yeah. So whenever actual culprit will get into your body, these pathogens, these antibodies will come out into the blood and they will kill this. Okay. Let me make this once again. Let me tell you once again. This pathogen is coming into the body. We have heated this pathogen. This is passive and this is not going to harm your body. It will be sensed by the B cell. B cell will produce some antibodies and B cell will kill this pathogen too. Okay, but these antibodies are still pre-made in your body. So whenever the actual culprit, the actual organism will enter in your body, these antibodies are already present to kill this pathogen. Okay. So this is the benefit of vaccination. But now, since your B cells are defective, they will not produce antibodies. They are unable to produce antibodies in this case. Okay. So what will happen when this inactive or passive pathogen will enter the blood, will enter the B cell? B cell cannot produce the antibodies. It will still this pathogen will still move inside your body. At any point, if this thing which was showing the passivity of the organism, of the pathogen, got removed for suppose due to any cause, this pathogen is now very nasty to your body. This pathogen will harm your body. You will not be able to recover from that. That's why these live vaccines are contraindicated, because this can actually cause these inactive pathogens get converted into the active pathogen inside your body, because you have not the antibodies inside your body, because your B cells are not able to produce these antibodies. So you got my point? Can you explain me this? Okay, tell me whatever you have understood. I will clear you out on that thing. Yeah. Okay, I told you that what we do to some pathogens, we make them passive. We make them passive by heating. Okay. For suppose these lined pathogens are now passive, and this pathogen is active. Okay, this pathogen is active. What we call these pathogens? Live attenuated. What does attenuated means? Passive, inactive. Okay, inactive, live attenuated pathogens. Okay, or heated pathogens, because we heat them to make them passive. Okay, so that they cannot harm to our body. They are just used to incite or stimulate. We will put them in, for suppose we will put them in a syringe. Okay, and we will enter them into our blood. For suppose this hole is blood. This hole is blood area. Okay, so they will enter your blood B cell. Still they are passive. Okay, they cannot harm your B cell right now. What B cell will think that there is a pathogen inside my body, so B cell will secrete antibodies. Okay, what B cell will do? Yeah, it will begin to fight or attack this by making antibodies. But for suppose B cell is unable to make antibodies because of the BTK gene defective. Okay, so B cell will not be able to produce these antibodies. So this inactive pathogen will roam around all your blood. Due to any cause, if its passivity got removed. Okay, are you understanding my point? If its passivity, for example, this line is showing its passivity. Okay, right now this is passive, but if it got active inside your body, this will harm your body, and no antibodies are present to protect you from this. Okay, I think okay. We will discuss the vaccination topic in deep discussion. But right now you have to keep this thing in mind that live vaccines are contraindicated in case of X-linked Bruton A gamma globulinemia. Okay, I have told you whenever you will listen the lecture, whenever you repeat this lecture, you will get my point hopefully. But I don't want to spend more time on this point right now because this is important point. But I have told you already. You can go and watch one again and again. You will get my point that why live vaccines are contraindicated in this patient. Okay, so in this case you will not vaccinate your child with live vaccinations such as rubella is I think a live vaccine it is. So you will not vaccinate your baby with that. Okay, let me because we have already did this IgA deficiency so many times. So let me complete this topic so that we can move further on. So selective IgA deficiency. Okay, selective IgA deficiency, the word itself is showing selective means that specific. IgA is an antibody, and deficiency you already know. Cause unknown. Okay, its cause is unknown. Most common primary immunodeficiency. Okay, this is the most common primary immunodeficiency. That means it is one of the most common, or it is the most common deficiency in case of immunodeficiencies. Okay, that is selective IgA deficiency. Majority people are on presentation. This presentation means symptoms. Majority people are asymptomatic, can see airway and GI infections. I have already told you so many times that IgA is present in your mucous membrane, and you have got your mucous membrane inside your respiratory tract and gastrointestinal tract. Okay, it is an autoimmune disease for sure. If it is IgA antibody which is performing the function of immune in your body, if it is deficient, it is due to the autoimmune. Okay, you have to keep this thing in mind that it is deficient just because of your own cells, just because of your body's self cells. It is autoimmune disease. Atopy. Okay, atopy is actually a kind of thing which is allergy, or which is kind of hereditary. You have got it from genetics. Okay, the word atopy refers to the genetic condition. Okay, allergy of a genetic condition. Anaphylaxis to IgA in the blood products. This is a point which should be which should be discussed. So let me tell you one thing. Normally what we have got in our body is IgA, IgG, IgE, IgM. Okay, so your body cells are very familiar with all these antibodies. The B and T cells already know that these antibodies are self products. These are all family members of my blood. Okay, but now for suppose you have got a patient. Okay, for suppose I am a patient. I don't have IgA in my blood. I have got IgG, IgM, IgE, but my body has not produced IgA in my blood for my whole lifetime. Okay, this is patient, this is person A. Okay, this is person A, or I can say can we name this as donor A, and can we name this as recipient B. Okay, for suppose this is the name of patients. Okay, for suppose donor A is the name of person who has got IgA, IgG, IgE and IgM in its blood, and recipient B is another person, another organism or a body who has got IgG, IgM and IgE in the blood, but he is suffering from selective IgA deficiency. We are clear? Okay, for suppose recipient B got a motor vehicle accident. He got bleeded. Okay, he lost his almost 2 liters of the blood. Now doctors are saying that go and find a donor for this patient. So you found a donor who was having the same blood group as this patient. You got the blood from this patient, okay, you got blood from this patient and you put this blood into this body. Now IgG, IgE, IgM, to all these antibodies his body is already familiar. Okay, are you getting my point? That I put blood, I got blood from donor A and put it inside the recipient B. The body of recipient B is thinking that IgG, IgM, IgE are same as present in our body, but we have got an other antibody which is something new for my body. Okay, recipient body B is thinking that I have got something else in my body. What is that else thing? That the IgA. Okay, let me write this in blue, which is normal, and write this in red in IgA. So this body is thinking that IgA is something foreign body. IgA is something foreign body. Okay, so this recipient blood is already familiar to IgG, IgE, IgM because he has got his own IgG, IgM and IgE, but this body has never been exposed to IgA. Now in the case of emergency, you are not aware that this patient is suffering from selective IgA deficiency. You got a blood and you put it into the patient to help that patient, but this patient's body thought that IgA is something foreign. So what its body did, it activated immune system against IgA. Okay, so that is like autoimmune, that is like dysfunction. Okay, so your instead of helping, you just put your patient into a problem of an active immune system. So your patient will get anaphylaxis, he will get shivering, he will get hypotension, he will reach the death. You can just imagine that how worse is anaphylaxis. Okay, he will get in a condition of allergy. Okay, can you explain me this thing? Because this whole scenario I have attempted a question in UWorld. I will show you sometime. I will show you at some else time, but this is important, that's why I spent time on this. I just exemplified this whole scenario. So can you explain me this? Okay, so it's not compatible. Yes, I am going to send you something on WhatsApp. Just read this thing. Okay, atopy, this is deficiency, this is definition of atopy. Okay, you have to keep this thing in mind, that we just cleared the concept of anaphylaxis to the IgA product in the blood products, but atopy is something that is genetic tendency to develop allergic diseases such as allergic rhinitis, asthma and atopic dermatitis, that means eczema. All these allergies are like, I am atopic. Okay, I have allergy of skin. That's just because and my elder brother has also. Okay, that means we both, and my mother has also got atopy. Again and again I get some respiratory tract infections in cold seasons especially. Okay, again and again in summer season I just get rashes in my body after carrying a heavy thing, or sleeping on a mat, or after sleeping on floor, or after sleeping on a charpai, because we use sometimes here charpai. Charpai is a kind of bed that is made up of net. Okay, so that net gets entered, so that net is I just get rashes in the shape of that net. Okay, so that this is a kind of atopy. Okay, I am atopic. that means I have got the genetic tendency from my mother, from my father, of developing allergic rhinitis again and again. I don't have asthma, okay, that's the other thing, that's other thing, but and I have got atopic dermatitis also, okay. I am very allergic to, I use my towels, I use my cloths, I use my soap very separately because I am very allergic, okay. So that is the thing, that is the genetic. So this is, I am not a selective IgA deficient, but we can get atopy in a case of selective IgA deficiency. Okay, am I clear to you regarding atopy? Okay, so what will be the finding which will be seen? Because in a scenario we always first get the age of a patient, then we get the symptoms or signs of the patient, then we get the laboratory findings of the patient. Okay, this first aid is written in a way that a scenario is always going to be completed in this whole 4 lines. Okay, scenario will come like that: there is a patient who is like immunodeficient or is asymptomatic or suffering from airways or GI infections or blah 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 things, or he got anaphylaxis to IgA blood products when he got a motor vehicle accident, and now the blood laboratories are showing that he has got decreased IgA with normal IgG, IgM levels, okay, and he has got susceptibility to giardiasis. This is the most important thing you have to keep in your mind, that giardiasis always happen to those patients who are going for hiking and they are drinking running water from the waterfalls, okay. So all the persons going for hiking, if they are using the waterfall, because for suppose 4 friends went towards the waterfall and they drank that water, but one of them got infection, one of them got diarrhea. So when we tested him, he got the foul smelly diarrhea, that was confirmed for giardiasis. That means he has something to do with IgA deficiency. There is a possibility, okay. And again, this giardiasis thing is also occurring because IgA is very much responsible for your GI tract, okay. IgA is very much responsible to protect your GI tract from pathogens and also your respiratory tract. Whenever IgA comes in front of you, your mind in a moment of second, in a moment of reflex, just go towards the GI tract, respiratory tract. IgA means GI tract, respiratory tract, okay. IgA means GIT and resp, okay. Am I clear? Respiratory tract, GIT and respiratory tract, okay. So moving on, can cause false negative celiac disease test and false positive serum pregnancy test. I don't want to go too deep into this, but just remember this thing: in those patients who have got IgA deficiency in those persons, you can get false negative celiac disease test, or you can get, that means those patients could have celiac disease but you can get still negative, okay. That means those patients could have celiac disease, but when you test them for celiac disease, they appear negative. So that's going to be false negative celiac disease test. Or you are testing a female of 18 or 19 years, okay, for the pregnancy test. She was positive, okay, but actually she is not pregnant actually. She could get false positive serum pregnancy test, okay. This is especially worrisome in virgin females, okay, in non-married females, okay. In non-married females or virgin females, you can get a patient who is very worried about his or about her condition, that I am not been active sexually for many years, or now I am or I am not been sexually active from the start, but I am positive for pregnancy test. So what is this? So you can check, you can go for, or your mind could go for selective IgA deficiency, okay. For some, or she could be a 50 years old patient, because at the age of 45 or at the age of 51 you get menopause, you cannot be pregnant after that time, okay. So how could be a pregnancy test positive at 55 years? So that there your mind could blink, okay. Your mind could get aware that there is something that has to do with IgA deficiency. I have to go for that. Okay, these all are not just the words. These are actually patients present in front of you. There is a patient. There is a patient with X-linked Bruton gamma globulinemia. There is a patient with selective IgA deficiency. This is not just a scenario. This is a life in front of you. You have to save it. Being a doctor, okay. Moving on, because we are just left with one B cell disorder, so we have to complete this. Common variable immunodeficiency. Okay, the word is showing common means common, variable means different, including involving different things, and then involving different kind of variability. Immunodeficiency, again the same thing. So this is defect in B cell differentiation. Cause is unknown in most cases, and it could present in childhood, usually diagnosed after puberty. Again, you have to keep these age groups in mind, because this patient will most probably be of 13 years or 14 years. Okay, and are you there? And this patient has got increased risk of autoimmune diseases, bronchiectasis, that means dilation of bronchioles or dilation of the respiratory tract, and this will patient feel or face the respiratory problems. This could appear as lymphoma, that means mass of the lymph nodes or mass of a lymph. Okay, then this could also appear as, because B cells are deficient, that means B cells are not getting differentiated, that means there will be no immunoglobulins or decreased immunoglobulins, and immunoglobulins are very much responsible to protect you against the sinopulmonary infections. Okay, and once again we have got our decreased plasma cells, because B cells have actually differentiate into your plasma cells, and those plasma cells are decreased here, and since plasma cells are decreased, obviously immunoglobulins will also be decreased. Okay, so moving ahead, we have already discussed so many times. So these three are the lone B cell disorders. We have to keep this thing in mind: X-linked Bruton gamma globulinemia, then selective IgA deficiency, then common variable immunodeficiency. Okay, then comes the thymic aplasia. We have already discussed so many times thymic aplasia. On the first day we discussed the DiGeorge syndrome. Okay, this is almost here almost everything is same, so I will discuss this very rapidly, because we are left with 7 minutes right now, so this will get completed. Okay, this thing is related to the T cell disorders. Okay, this is a lone T cell disorder. In these cases only T cell will get defective. In thymic aplasia, the word thymic means related to thymus, and aplasia means decreased size or maldevelopment. Okay, I already told you on the day first that there is a gene on chromosome 22 on the 11th space on the small parameter on the small the gene has got one larger parameter and one smaller parameter. The small q is showing smaller parameter. Okay, I actually don't remember the actual word or actual terminology for that parameter, but just keep in your mind that this problem is occurring on chromosome number 22, and it is named as 22q11 microdeletion. That means it is occurring on there is a deletion on a microparameter, on a small parameter of the 22q11. Okay, failure to develop, and that's why what happens due to absence or due to maldevelopment of 22q11, there is developmental problem with neural crest cells. Okay, neural crest cell motion, neural crest cell movement is disturbed. Okay, that's because of 22q11, and ultimately there is failure of, because these neural crest cells are responsible or they play a role in their role in the development of the third and fourth pharyngeal pouches. Since these neural crest cells cannot move, so that third and fourth pharyngeal pouches will not be present in your body. That's why there will be absent thymus and parathyroid gland. Okay, since thymus is absent, so no T cells will get educated. Okay, that's why T cells will have the disorder, and T cells will be unable to perform its immune system functions. And since the parathyroid glands have a specific function of relieving parathyroid hormone or parathormone. Okay, releasing parathormone. Okay, what does parathormone do? Reserves calcium in your body. Okay, from GIT, by absorption from GIT and from kidney. Okay, in kidney it repels or cancels the excretion. Okay, it cancels the excretion of Ca++, or simply it helps the absorption of Ca++ in kidney and GIT, this parathormone. Okay, are you getting my point? This parathormone is responsible to reserve calcium in your body, and this parathormone get released from parathyroid gland that is present just above or behind your thyroid gland, and this thyroid gland is present in the mid of your neck. Okay, you can just palpate thyroid gland in your mid of neck, Adam's apple. Okay, then what happens due to these all things? There happens a syndrome. Syndrome is an umbrella term for different diseases. That the syndrome is called as DiGeorge syndrome. In that syndrome, thymic aplasia, parathyroid and cardiac defects occurs. Okay, we have already discussed this so many times. Then comes in a different syndrome that is also related to thymic aplasia, and then that is velocardiofacial syndrome. The word velo is showing palate. Okay, palate of your mouth, palatar velatini. There is a muscle named villi palatini. There is a muscle, I don't remember actually its name. That means velo shows the palate. Okay, cardio shows the cardiac defects and facial shows the facial defects. Okay, these all also have association with the thymic aplasia. Association means they could occur concurrently. Okay, then there is a mnemonic to remember the presentation of this patient. Okay, this is Catch-22, cardiac defects, C for cardiac defects, and in those cardiac defects there is conotruncal abnormalities. What are conotruncal abnormalities? We will discuss that later in the CVS module. Right now you just have to remember the cardiac defects. That could be tetralogy of Fallot, truncus arteriosus. Just remember these names. I will discuss that later into the CVS module. I will explain this there. Now abnormal facies could occur, and thymic hypoplasia could also occur, could lead to T cell deficiency, recurrent viral or fungal infection, because T cells are responsible to protect you from the viral and fungal infections. Cleft palate could also occur. Hypocalcemia secondary to parathyroid aplasia could also occur. Okay, because since the parathyroid gland is releasing parathormone that reserves the calcium, if this parathyroid gland is not present, there will be no parathormone, no calcium will be reserved in your body. You will suffer from hypocalcemia, and hypocalcemia leads to tetany. I already told you in the previous session. You can go into the previous lectures and search there that how tetany occurs because of hypocalcemia, or in some next sections like neuro, I will also discuss that later. Okay, just keep in mind that due to hypocalcemia you can get seizures or tetany. Okay, and then comes the findings that are laboratory findings: decreased T cells, decreased parathormone, decreased calcium. These all will be present in your, these all will appear in your lab test, and on chest X-ray, on radiological X-ray, you will observe thymic shadow is absent. Okay, I think right now I am clear to you regarding this thymic aplasia, and now almost our 2 hours are complete, and I have to go to some place. Okay, thank you so much for your time. Do you have got any question? I can answer that in yeah. Okay.